Actually, it's Wednesday afternoon, and I'm just popping in here quick between some appointments here at the clinic. Yes, it's spring break week. All of my colleagues have taken the week off, but I'm still here seeing people for most of the week. But I wanted to answer a question on a post that I posted. I think it was late last week or early this week. I put a post up about some research on weighted blankets and how weighted blankets have been shown to be helpful for calming and to support sleep in children and adults. And somebody responded on there asking, what good are weighted blankets if my child is still wetting the bed every night? And that we kind of got into a little bit of a discussion about what's going on with her child, and she gave some information and asked some questions, and I said, can I get on a Facebook Live and just respond to some of that, because I think it's easier to do live like this than it is trying to write it all out. So this response is for Candy, related to her 11-year-old son, and hopefully some of you will find the information helpful too. So she says that her 11-year-old son has many health issues: Lyme disease, sensory processing issues, asthma, immediate and delayed allergies. So sometimes delayed allergies, another term for that is food sensitivities. Just finished a certain program that he was involved in treatment-wise for 6 months. He is constipated, a picky eater, his head, tummy, and legs hurt, and mornings are hard. So there's a lot of things within there, and some of you may have kids who have similar types of things, and some of you as professionals may work with children who have a lot of these similar kinds of issues. So I just want to briefly share some of the things that I start to think about when I hear this list of symptom issues. And she said too, further down in the comments, that her son's not been doing well for a few years. It's been a really hard few years, and I can certainly understand that, especially given the issues that have gone on. So when I think about all of these things going on for this child, one of the first places that my mind goes is to gut health. So this is a child who's got a lot of immediate allergies, as well as delayed allergies, food sensitivities. And when I hear that, I start thinking about leaky gut. The immune system is overactivated and is fighting foods and things that it shouldn't, and gut health is a major issue with that. We can either have, an imbalance of gut bacteria. Bad gut bacteria overtakes the good gut bacteria, and that can cause some of those problems. There can be a lot of issues with that, but I start thinking about gut health. This child also has had Lyme disease. So with Lyme disease, and that can be so chronic and insidious, and actually a lot of kids have Lyme and it never properly gets diagnosed because it's pretty tricky to test for. A lot of practitioners don't even know what they're looking at with that or how to identify when that might be there. But Lyme disease can cause problems with gut health as well as whole body health. That bacterial infection can really take over. Especially antibiotics are traditionally used to treat Lyme. And antibiotics can really take a toll on gut health too. So I'm thinking about that with this case. Asthma, another trigger for me to start thinking about gut health and just how well the body and the immune system is functioning. He's constipated, which definitely says that something in the gut is not working properly. And chronic constipation can really take a toll with kids on behavior, on their mood, on their sleep, all of those kinds of things. So my first thought would be to address issues of the gut and to work on some gut healing. And that can involve a lot of different things, but I'd be looking at potentially using probiotics, which are good bacteria that you put into the body in capsule or powder form to help heal the gut. I'd be looking at maybe enzymes, which are, again, a capsule or a powder that you take with your food to help break it down. So those are some possibilities. I'd also be looking at the child's diet. Are there certain foods or things that the child is eating that are exacerbating these symptoms? Sometimes an elimination diet, pulling a bunch of things out to see what the child is reacting to, can be helpful. This child's a picky eater, and that can make changing the diet somewhat difficult sometimes, but I would still be looking at how can we make some small changes, especially if the child's consuming foods that have shown up as either immediate or delayed allergies. That's something we would want to look at putting a plan together to remove those. Also, when I hear picky eater, I think about iron and zinc deficiency in particular. It's been my experience, and there's some research to back this up, that kids that are iron deficient or zinc deficient can be pretty picky. It can also be the case that kids who are reacting poorly to foods that they're eating, dairy, for example, is a big one, when they're having delayed food reactions, food sensitivities, when their body's not able to process that well, that can really show up in really picky eating as well. So I'd want to look at some of those things. More immediate term, magnesium is what comes to mind. Magnesium citrate is really good for helping to relieve constipation. So I'd be looking at that, maybe in some combination with fiber, either in the diet or supplemental, to look at how we can start to relieve some of the constipation. Magnesium can also help with just soothing and calming the nervous system, may help with some of the leg and just body pain that the child this child is having as well. So I'd be thinking about magnesium, specifically in this case, because the child's constipated, magnesium citrate, which can help move the bowels more quickly. If you have a child that tends towards loose stools, then magnesium citrate is not what you want to use. But in this case with constipation, magnesium citrate once or even twice a day, I'd be looking at somewhere probably between 300 and 800 milligrams over the course of the day, depending on the size of this young man and kind of what he's getting in his diet, but that would be something that I would be thinking about. I'd also be looking at sleep. How is this child sleeping? Is he falling asleep well, staying asleep well, getting enough quality sleep? Because that can certainly have an impact on these other symptoms. So those are some of the initial things that I'd be thinking about. And Candy, I hope that that maybe gives you some avenues to pursue. It sounds like you've been through a variety of treatments over time. Maybe that gives you some new things that you could consider. Definitely don't give up. Don't give up on finding answers, because your son has a lot of things going on, and there definitely are ways to address and resolve all of these things. Sometimes it can just take a little detective work and working with somebody who really knows what they're looking at with that. For all of you, I do want to point out an interesting thing related to constipation and wetting issues, because that's originally how this dialogue in the comments section of that post started. Is Candy said, you know, my son is 11 and still having issues with bedwetting. And I work with some kids, even through the later elementary, middle school, high school years, who struggle with daytime wetting periodically too. Constipation can play a huge role in that. If you think about the physiology of the body, when a child is constipated, their colon, so the lower part of their intestinal tract, gets really expanded and filled with stool. And when that happens, it can create pressure on the bladder and other, it kind of creates, expands and creates pressure on the entire system down there. And that can cause difficulties with wetting, because it can make it difficult for a child to tell when it is that they need to relieve themselves and urinate. Their body, the nerves in that lower part of their body, becomes so used to the sensation of their colon being filled with stool that they're not even really recognizing when they're having the sensation that they need to urinate, so they may have accidents that way. The pressure down in that area can cause some bladder leakage. So if your child is chronically constipated or prone to constipation and is having wetting issues, it's important that you see the connection between those two things. So very often when we look at addressing and relieving the constipation issues, then wetting issues can certainly improve. So just something for you to be aware of. Hope that's helpful to all of you. I'm going to hop back to patients now and finish out my day here at the clinic, but I'll try to get on here again later this week and give you some more information and tips. If you have questions you'd like me to answer for you, throw them in the comments, and I'll be happy to do my next Facebook Live answering your questions. Thanks. Have a great rest of your day.